In this video, you are going to learn how to perform traction to assess and treat the whole capsule of the hip joint. Hi and welcome back to Physiotutors. The aim of traction is to gain information on joint play and to treat the whole joint capsule in case of high reactivity. To assess the joint play of the whole capsule of the hip joint, have your patient in supine lying position. You can fixate the patient's pelvis with a strap. Stand lateral to the hip you want to examine and place the leg over your shoulder so that it is flexed to 90 degrees. Using both hands, grab onto the patient's femur as proximal as possible from medial ventral. The patient is instructed to relax as much as possible, and then you will apply traction in lateral, ventral and caudal direction. Here, the ventral component is going to come through your shoulder by moving your body upwards, whereas the caudal lateral component is coming from your hands. This technique can be modified by altering the hip flexion angle or by adding abduction or adduction components, as well as rotations. For example, a higher flexion angle would focus more on the caudal capsule, whereas a lower flexion angle would focus on the cranial portion of the capsule. As an alternative, you can use secondary traction. Make sure that your patient has no knee complaints that would prevent the execution of this technique. To conduct this technique, the patient is in a supine crook-lying position with the leg to be examined lying flat on the bench. It's advisable that there is no sheet on the bench and that the patient's lower back is exposed to have more friction, which helps with fixation. Standing caudal to the patient in split stance, grab onto the leg with both hands just above the malleoli. The leg is then brought into 30 degrees of flexion, 30 degrees of abduction and slight external rotation. Keeping your arms straight, you can then apply traction by leaning onto your back leg. If you find that joint play is reduced compared to the other side, or if you want to decrease pain in case of a highly reactive hip joint, you can move on to treatment with this technique. You can dose your techniques according to the Maitland grades of mobilization. In case of traction techniques, oftentimes an oscillating movement with a high frequency is applied with Maitland grades 1 and 2 with the goal of decreasing pain. If you want to learn about these concepts, take a look at the video in the top right corner. Okay, you've reached the end of this video. If you want to learn how to apply traction at the knee joint, click on the video right next to me. Thanks a lot for watching. Don't leave without subscribing to our channel and dropping a like if you enjoyed this video. So this was Andreas for Physiotutors. I'll see you next time. Bye.